HIV is a virus that attacks the immune system and can lead to AIDS. AIDS is the most advanced stage of HIV infection, where the immune system is severely damaged, and the person becomes vulnerable to life-threatening infections and cancers. The first documented case of AIDS was reported in 1981 in the United States. However, it is believed that the virus has been present and spreading for several decades before the first cases were identified. Since the first cases of AIDS were reported, the virus has spread globally and has become a major public health concern. As of 2021, it is estimated that approximately 38 million people worldwide are living with HIV, and that the virus has claimed the lives of approximately 32 million people since the start of the pandemic. The number of deaths due to HIV has declined significantly in recent years due to increased access to antiretroviral therapy, which can effectively control the virus and prevent the progression of AIDS. Signs and symptoms of HIV/AIDS. The early signs and symptoms of HIV infection can be similar to those of many other viral infections and may not be noticeable, or they may be mistaken for another illness. Common early symptoms of HIV infection can include flu-like symptoms such as fever, fatigue, muscle aches, and sore throat. Other symptoms include night sweats, nausea, vomiting, and mouth ulcers. However, some people may not experience any symptoms for several years after becoming infected. The only way to know for sure if you have HIV is to get tested. As the virus progresses and the immune system becomes damaged, people with HIV may develop symptoms related to AIDS, such as weight loss, pneumonia, tuberculosis, and certain types of cancer. It is important to remember that early diagnosis and treatment can help slow the progression of the disease and improve health outcomes for people living with HIV. Transmission of HIV/AIDS. HIV is primarily spread through sexual contact, sharing of needles or other injection equipment, and from a mother to her baby during pregnancy, childbirth, or breastfeeding. The most common ways of transmitting HIV include sexual contact. HIV can be transmitted through unprotected vaginal, anal, or oral sex. Sharing of needles or other injection equipment. HIV can be transmitted when a person shares needles or other injection equipment with someone who is infected. Mother-to-child transmission. A mother with HIV can pass the virus to her baby during pregnancy, childbirth, or breastfeeding. It is important to note that HIV cannot be transmitted through casual contacts, such as hugging, shaking hands, or sharing utensils. Pathology of HIV and AIDS. HIV is a virus that attacks the immune system by infecting and killing CD4 T cells, which are a type of white blood cell that play a critical role in the body's ability to fight off infections. As the virus continues to multiply and destroy CD4 T cells, it weakens the immune system and makes the person more susceptible to other infections and diseases. The initial stage of HIV infection is called acute HIV infection, which can last for a few weeks to several months and is characterized by flu-like symptoms. After the initial stage, the virus enters a period of latency where it is present in the body but does not cause symptoms. During this time, the virus continues to multiply and damage the immune system, but at a slower pace. As the number of CD4 T cells decreases, the person becomes more susceptible to infections and diseases that they would otherwise be able to fight off. This is referred to as AIDS, acquired immunodeficiency syndrome, which is the most advanced stage of HIV infection. People with AIDS are at high risk for life-threatening infections and cancers, and require ongoing medical care and antiretroviral therapy (ART) to manage the virus and maintain their health. It is important to remember that early diagnosis and treatment of HIV can help slow the progression of the disease and improve health outcomes for people living with HIV. Prevention of HIV and AIDS. To prevent HIV transmission, it is recommended to use protection, such as condoms, during sexual activity. Never share needles or other injection equipment. Avoid unprotected sex or limit the number of sexual partners. Get tested regularly for HIV and other sexually transmitted infections, STIs. If you are pregnant and have HIV, get early and ongoing medical care to help prevent mother-to-child transmission. Is there any cure for HIV/AIDS? Currently, there is no cure for HIV/AIDS. However, antiretroviral therapy, ART, can effectively control the virus and help people with HIV live long and healthy lives. ART works by suppressing the virus and slowing the progression of the disease. When taken as prescribed, ART can lower the amount of virus in the blood to an undetectable level, which makes it much less likely to transmit the virus to others and helps to preserve the health of the immune system. In addition to ART, there are also other medications and treatments available to help manage the symptoms and complications of HIV/AIDS, such as prophylaxis for opportunistic infections and treatments for co-occurring conditions such as depression and heart disease. While there is currently no cure for HIV/AIDS, significant progress has been made in the development of HIV medications and treatments, and research continue in the search for a cure.